안녕하세요. NY필치과 원장 임필입니다.
Greetings, I'm Dr. Impir of LIM Pill Dental Clinic. I'm honored to meet with you as a Master Course Basic Director. Albeit within a short time frame, we're going to address part of the offline basic course. Today I'm going to talk about local anesthesia. Local anesthesia is applied not just in implanted treatment, but in all dental treatments. This is what is done at the very first stage. I'm sure a lot of you have studied it when you were in school. I'm sure you're fully aware and am performing local anesthesia under such knowledge, but I would like to take this time to review what we've learned in the past. Let's look at the overview of local anesthesia. Let's look at the definition. It blocks not only pain, but also blocks all sensory signals, including temperature, pressure, and touch. Also, it induces loss of motor functions as well. In doing local anesthesia, before we inject, we need to check for aspiration. Because the lidocaine should not be injected directly into blood vessels, you need to check penetration of blood vessels. You need to remember this. If the lidocaine is directly injected into blood vessels, it can cause central nervous system toxicity as well as cardiovascular disease. When using injection syringe, if there is a ring form here, you can pull back the syringe to avoid aspiration. Using this kind of syringe, it would be favorable. I use this type of syringe. You always need to remember the process of checking for aspiration. Classification according to the range of anesthesia injected can be largely divided into three. Topical anesthesia or surface anesthesia. This is a subsidiary measure. Therefore, before doing infiltration anesthesia or block anesthesia, anesthesia on the mucosa is performed. Infiltration anesthesia. As for infiltration anesthesia, the scope is limited to where the anesthetics go in. Third is block anesthesia or conduction anesthesia. Analgesics is inserted to nerve trunk and the entire region becomes numb. Topical or surface anesthesia is, as mentioned, is an auxiliary means. I'm sure a lot of dentists have such topical anesthesia available. It comes in liquid form as well as ointment and gel. In the area where the needle goes in, if such surface anesthesia is applied, you can numb that area and minimize pain when the needle goes through. Topical anesthesia include lidocaine, which is really well known. Next is infiltration anesthesia, which is done most frequently. As for infiltration anesthesia, the scope is limited to the area where local anesthesia is accumulated. We can limit the area. The pro of this way is that it's very simple and there's very low risk of intravascular injection. Also, it contains a vasoconstrictor, which delivers a hemostatic effect, which is necessary in clinical situations. Cons. The anesthesia does not work well if there is inflammation. In the area where there is inflammation, the acidity of the tissue goes up, and in that case, the effect of anesthesia is lower. In the area where there is inflammation, it's difficult to perform infiltration anesthesia, and it has very quick valid time. It is only valid to the area where local anesthesia goes in. Therefore, thus, the number of penetrations go up. In comparison, when we look at block anesthesia, the entire area where there's nerve becomes numb. Local anesthetic is injected into the nerve root to paralyze the peripheral nerve. When we look at the pros, it's more extensive and in-depth anesthesia can be performed. This is the benefit of block anesthesia. With very small amount, you can get very extensive anesthetic effect. The patient feels numbness for a longer period of time. Previously, I've talked about how it is impossible to use infiltration anesthesia in areas where there is inflammation or infection. However, in the case of block anesthesia, anesthesia can be performed by avoiding that infected area. Even in areas where there is inflammation, anesthesia can be performed. This is the benefit of block anesthesia. Compared with infiltration anesthesia, the number of needle penetration goes down comparatively. The downside is that because we find the nerve and penetrate the needle in that position, at times, there is a risk of intravascular injection. There's higher risk compared to infiltration anesthesia. Therefore, there can be systemic side effects. Also, there's a risk of nerve damage. When we perform anesthesia, we use a sterilized disposable needle. And the injection solution should be maintained at room temperature. It's the same for all of us, but when we perform anesthesia, when the injection solution is too cold when the injection is performed, the patient feels more pain. Therefore, if possible, we need to maintain the injection solution at room temperature. If the weather is extremely cold or if the room temperature is quite low, you need to use additional measures such as warmer to keep the ampoule warm. This is a way to minimize patient pain. Patient position needs to be, if possible, in a stable supine position. This is necessary to maintain the blood pressure stable. We need to pay attention to that as well. And as mentioned when I was talking about topical anesthesia, rather than doing infiltration or block anesthesia straight away, in the area where the needle goes in, use the topical anesthesia first and then perform infiltration or block anesthesia in order to minimize patient pain. Also, in order to gain a proper visibility, this is done to get proper visibility and we need to prevent the bacterial infection. I'm repeating this continuously, but we need to watch out for aspiration. If possible, Insert the needle slowly and inject the injection solution slowly after aspirating. Make sure you do this very slowly. This is a way to reduce patient pain rather than injecting directly on the periosteum. Inject a few drops of anesthetics before you reach the periosteum. You need to gradually advance towards periosteum, and this is a way to minimize patient pain. These kind of products are available in the market. I have one of these. You can reduce patient pain by utilizing our knowledge and performing anesthesia with our hands very slowly. However, you can utilize these options as well. In the market, they're referred to as painless anesthesia, but I doubt it's completely pain-free. But I believe if you have these equipments to minimize patient pain, then it will be more comfortable for the patient. There can be failures of local anesthesia. There are a couple of factors. First is anatomical displacement. Second is vascular injection of local anesthesia, which will lead to failure. Third is the area with inflammation. Anesthesia can be difficult in such areas. You need to utilize infiltration and block anesthesia depending on different situations. Also, the amount of injection solution may be insufficient. Second, I'm going to talk about mandibular nerve anesthesia method. Compared with the upper, the bone thickness of the lower is thicker. It's very thick, therefore, it is difficult for anesthesia to penetrate. Yes, infiltration anesthesia can be used, but considering how thick the mandibular bone is, block anesthesia is used frequently. Let's look at the main branch of mandibular nerve. As we all know, there's the lingual nerve and inferior alveolar nerve. If you take a closer look at the image, inferior alveolar nerve and lingual nerve are forming a branch in a similar point. To be more specific, the lingual nerve runs slightly more front compared with the alveolar nerve, and it runs more towards the inner surface. In the case of inferior alveolar nerve, it runs through mandibular foramen into the mandible. Right before entering foramen, there's a split in the nerve, and it is mylohyoid nerve. Into the foramen and through mandibular canal, and through mental foramen it comes out again, and from this point it is referred to as mental nerve. In doing anesthesia in the mandible, we need to understand the basic anatomic structures. As mentioned, inferior alveolar nerve, mylohyoid nerve, mental nerve, incisive nerve, mental nerve, buccal, and lingual nerve. You need to understand the basic position and structure of these nerves in order to do a proper job in anesthesia. As shown in this image, this is how block anesthesia is being done. Here's the mandible, and you can see nerve and artery, vessel, and muscles. When we do block anesthesia, at times we can poke a vessel or add muscle. Therefore, you need to check whether the blood comes out through aspiration process, and we need to make sure that we don't inject within the vessel. If you poke at the muscle wrong, when the injection solution goes in, you feel more resistance. If done wrong, it'll cause significant discomfort to the patient, such as inability to open and close mouth. Therefore, we need to make precautions in order to avoid such issues. The key in the mandibular region is inferior alveolar nerve. Let's talk about block anesthesia for inferior alveolar nerve. I've mentioned that in front of inferior alveolar nerve is lingual nerve. In order to do anesthesia on inferior alveolar nerve, when we do block anesthesia, because they're in similar positions, anesthesia on lingual nerve and inferior alveolar nerve can be done at the same time. If you look at how the inferior alveolar nerve is positioned, you need to understand pterygomandibular space. The inferior alveolar nerve runs from the most anterior and inferior position within the pterygoid mandibular space up to here, as shown in yellow in this image. The inferior alveolar nerve passes through mandibular foramen. This is how it runs. This is lingual nerve. Anesthesia can be done on the lingual nerve at the same time along with inferior alveolar nerve. In doing block anesthesia in inferior alveolar nerve, there are multiple ways to do this. Multiple options are available. The most conventional method is as shown. This is used to prevent pain from the mandibular posterior molar area to the midpoint. The needle must reach the mandibular sulcus immediately anterior to the mandibular navel. We need to find that position to penetrate. As mentioned, in order to do anesthesia on inferior alveolar nerve, you need to find the mandibular foramen position. And if you do anesthesia, because lingual nerve runs in similar position, anesthesia on lingual nerve can be done at the same time. Conventional block infiltration method was looked at. Mucosal ridge, which is above the external oblique ridge and pterygomandibular raphe, needs to be checked. If you take a look at this image, put the thumb of the opposite hand, not holding the syringe, inside the mouth and press the cheek. Tell the patient to say ah, and the thumb of your left hand will be positioned as shown. You need to use your tactile senses to identify where the needle is going to go in. Put the thumb of the opposite hand, not holding the syringe, inside the mouth. Press the cheek, connective tissue, and buccal fat pad to the outside. And firmly grip the posterior margin of the mandibular ascending ramus with the rest of your fingers. In other words, your thumb is in patient's oral cavity and the rest of your fingers are gripping the posterior margin of mandibular ascending ramus. After that, place your thumb on the most depressed part of the coronoid notch while keeping it parallel to the occlusal surface. This point where the needle goes in needs to be in parallel with occlusal surface. Everyone has different oral structure, so it may vary, and it is normally positioned about 1 centimeter above. I'm going to talk about it later, but at about middle point of your thumb, that's where the needle is going to go in. Mandibular foramen. Where we need to put in the needle is the mandibular foramen. We inject towards the mandibular foramen, and before we do block anesthesia in order to reduce patient pain on the mucosal surface, topical anesthesia is performed. When doing this, you need to dry the mucosal surface sufficiently, apply the topical anesthesia, and wait for a couple of minutes for the anesthetic effects to kick in before placing the needle. So there, you can think of the horizontal position and vertical position. If you look at the written text, it's very difficult to understand. So I believe visual aid is more effective. As mentioned, the thumb of your left hand goes in patient's oral cavity and is positioned on the mucosal ridge. If you look at the fingernail of this thumb, and when you roughly divide it into two, the middle point is the height. That height is about 1 centimeter above the lower occlusal plane, about 6 to 10 millimeters. If you look at a different image as shown, in this direction, the inferior alveolar nerve runs, and towards the mandibular foramen, injection is made. Let's look at it from a different angle. When we directly perform block anesthesia on inferior alveolar nerve, place the syringe in the mandibular premolar area on the opposite side of where it's going to be injected with anesthesia. So we approach it in diagonal direction. This is not an absolute figure, but in general, needle goes in by 2 to 2.5 centimeters. Pterygomandibular space is where injection is going to be made. This is a different method. We have talked about the traditional way to do block anesthesia on inferior alveolar nerve. There's also another way called Gao-Gates mandibular block method. A dentist called Gao-Gates devised this method. It does anesthesia not just on inferior alveolar nerve, but on the entire mandibular nerve. The entire mandibular nerve branch is anesthetized. More extensive effect can be gained. There's going to be an image later, but the needle is going to be inserted on the neck of condylar area, neck of condylar process. The needle is inserted into the inner side of the condylar. All the nerves, including the inferior alveolar nerve, lingual nerve, mylohyoid nerve, auriculotemporal nerve, incisor nerve, and mental nerve, as well as buccal nerve, can be anesthetized. The downside is that Although we only want targeted site to be anesthetized, the entire mandibular nerve becomes anesthetized, so it can become too extensive and patient discomfort can increase. Let's look at the image once again. The needle angle looks too similar towards this side, but actually, if you look at a different image, which I'm going to show you later, the needle is going in from the other side, from the canine on the other side towards this area. The needle is inserted in the mandibular condylar neck, and the needle goes in this area. There is no fascia dividing the boundaries, so the injected solution can be diffused easily. Let's look at an image like this. Approximately from the canine on the other side, the needle is inserted towards the neck of condylar process, towards the inner surface. When the patient is opening his or her mouth from the side, as the patient is opening mouth, from below the patient's tragus area or the patient's ear, this is the angle you get. This is how block anesthesia is performed using Gao-Gates method. The needle is inserted to the buccal mucosa slightly distal to the height of the mesiolingual cusp of the maxillary second molar. At this point, you need to palpate the leading edge of the mandible with your thumb and use rest of your fingers to support the tragus. You need to provide the support. Let's look at the insertion point. It says, as shown in the image before, you need to target buccal mucosa slightly distal to the height of the mesiolingual cusp of maxillary second molar. When the needle touches the bone surface of the mandibular condylar, withdraw the needle slightly. It needs to touch the bone surface, and then you need to withdraw by 1 or 2 millimeters and inject it gradually. Aspiration needs to be performed. You need to make sure it doesn't go into blood vessels. Once block anesthesia is performed on an inferior alveolar nerve, as shown in this image, what is shown in purple is where it has been anesthetized. What you need to take notice is that the buccal part of lower molar area is missing from the purple area. When we do inferior alveolar nerve block anesthesia, in order to get the anesthetized effect, we need to do black anesthesia on buccal nerve again. When we look at mental nerve, as you all know, this is a terminal branch of inferior alveolar nerve. The inferior alveolar nerve goes into mandibular foramen and comes out towards mental foramen through mandibular canal. The branch that comes out towards mental foramen is called the mental nerve. Doing block anesthesia on mental nerve means that we need to target the mental foramen area. We can check the location on X-ray image.
멘탈 포레이먼의 위치를 찾아서 그 부위에 마취를 시행하는 것을 얘기하고
However, it is difficult to obtain sufficient anesthetic effect. That is the downside.
마취 효과를 얻기가 어렵다.
This is not a frequently used block anesthesia method. In order to directly perform anesthesia on mental nerve, mental foramen location should be looked at and injection should be performed there. Insert the needle into the vestibule from the outside, approximately 1 centimeter behind the buccal foramen. Also, the needle needs to be inserted until it comes into contact with the buccal alveolar bone. Once block anesthesia is performed on mental nerve, the nerves that run through the mental foramen are anesthetized. When you look at this image, what is shown in purple is numb. Let's look at buccal nerve. I've mentioned this earlier. When we perform treatment in the mandible, the most prominent block anesthesia is performed on inferior alveolar nerve. On the buccal side and distal side of the molar area in the lower, it cannot be anesthetized with just inferior alveolar nerve block anesthesia. Therefore, additional block anesthesia needs to be performed on buccal nerve. For most distal teeth in the lower, in order to perform block anesthesia, buccal nerve block anesthesia needs to be performed. The buccal nerve itself is superficial. Therefore, immediate access is possible. As written, anesthesia should be applied to the back of the mandibular third molar or second molar. Anesthesia should be inserted towards the back. As was with the rest, you need to insert the needle to the level it touches the posterior buccal side of the most distal molar. After that, you need to perform anesthesia as mentioned. If you look at the image, the position is here where the needle should be inserted. The buccal branch of the mandibular nerve, we know already where this is positioned. Following the position, we need to insert the needle accordingly to the distal part of the most distal teeth in the lower. As shown, when you do block anesthesia on buccal nerve, the area that is shown in purple is anesthetized. This is how block anesthesia is performed on buccal nerve. Today we have looked at the basics of local anesthesia, in particular block anesthesia, albeit in a short time period. If you're interested in specifics, you can study them in offline course with me. Thank you.
이보다 더 자세한 사항들은 오프라인 코스에서 저와 함께 공부해 보실 수 있겠습니다. 이상입니다. 감사합니다.